Here's your host, health and wellness correspondent, Lee Kelso.
Hey, good morning. So glad to have you with us here on a beautiful Saturday. Again, 67 degrees, heading for high today in the middle 80s. Another fantastic day to get out there and get busy around your life. Unless that is, you have a problem with vestibular disorders, and that is dizziness and vertigo. I didn't realize this, but there are about 10 million Americans who go through this problem every year. It's one of the leading reasons that people over age 75 go see a doctor. I had no idea the problem was that severe, so I'm happy today that we have someone in the building here who's going to be able to help you out. And that is a physical therapist by the name of Craig Maden from Steppin Up Physical Therapy. Craig, so glad you're here.
Yeah, thanks for having me, Lee.
What do people generally tell you when you work with them at Steppin Up Physical Therapy, helping them get their balance back? What are they feeling?
If you have vestibular issues or balance issues, you may be feeling a multitude of different things. Most common is spinning. I'm spinning or the room's spinning around me. You don't have to be spinning, though. It could be also just general dizziness. Perhaps maybe I feel foggy. I feel uncoordinated. I feel fatigued. I feel shaky. I have a hard time concentrating. These are some of the symptoms I get told on, or we get told on a regular basis. Some of the triggers, though, perhaps like I go to the grocery store and all the busy colors and shapes and people, I can't handle it. It's too much for me. It makes me feel dizzy or off balanced. Or, hey, when I roll in bed or I get out of bed or I get out of a chair, these are my triggers. These cause me to feel funny or unsteady. These are some of the common complaints we hear at Steppin Up.
And let's talk a little bit about dizziness versus vertigo. They're different, right?
Correct, yep. So vertigo is essentially, the true definition of vertigo is a sensation of spinning, okay? I feel like the room's spinning or I'm spinning in the room, even though I'm not moving at all. Dizziness can be some of those things I talked about, like uncoordinated, I feel shaky, I just feel off. If you have the dizziness or the vertigo, we go in different paths in treatment typically. Yep.
And we're going to talk about that in just a moment, explaining exactly what the treatment is and how effective it can be. But let's talk a little bit more about that system, the vestibular system. It's your inner ear that controls balance, but there's more to it than just your ear. Let's start there.
Correct. Vestibular system is very complicated. In medicine, I think we're learning more and more about it every year. 20 years ago, we didn't know what it was until now. It's a difference in knowledge from 20 years ago till now. So 3 systems, like you talked about. You have your inner ear. Okay, you have 3 canals or semicircular canals. They kind of look like moons or U's. Okay, on each side of your ear. You have 3 of them. They point in different directions. Believe it or not, that's how we sense 3-dimensional shape as well. Okay, so you have those 3 canals. And they have fluid in them. And when you move your head, it moves the fluid. And that gives us a sense of head movement. Okay, so when my head moves, those inner ears or the canals will tell you where you are in space. You have your eyes. If you've tried walking in the dark, you know it's hard to walk in the dark. You feel unbalanced, you feel unsteady. So our eyes give us a lot of visual stimulus, a visual cue. I can see how far things are. I know how far you are from me. If I want to go reach and grab my cup, I know exactly the depth and the distance. And also, it's your eye's ability to track things smoothly. I can watch a car go by, or I can go from one object to another. Are my eyes coordinating correctly? Not talking necessarily vision. I'm not going to help you get out of your glasses, but we can help you handle stimulus, okay? Handle busy areas like a grocery store. So that's the second. So there you got the inner ears, you got the eyes, and the third one is called your somatosensory system, and that's just a fancy word for sensation, okay? I can feel what's on the bottom of my feet. Like I can feel what's grass and gravel without looking. I can feel if I'm walking on carpet or tile without looking. You have sensory perception or sensory organs in your tissues, and they give feedback into the brain. Those 3 systems, the inner ear, the eyes, and the sensory, they all work in unison to give you your equilibrium, your steady state. They're constantly gathering input, information, and it's going to the brain, and the brain is sending out output. That's how our body senses. Just to stand still or sit is very, very complex. People don't realize how much is going on just to stand still.
Sure.
We all have a natural sway about us, and you don't even know it. I have a laser I use with vestibular patients. It's like a headlamp. It's got a red laser. It's not fancy, but it does the job. And if I put that on their head and I say, hey, just focus on this dot on the wall, it's extremely difficult for people. They don't realize how much natural sway they have. It's like a shock. It's like, I didn't know I was that unsteady. No wonder I have trouble going up the stairs or down the stairs or going to the grocery store. So, yeah, it's a very complicated issue as far as what can be going on, but we look at those three systems. Sometimes people have one system that's deficient or not working correctly, if you want to call it that, or sometimes it's two or even three. So we go about the individual and have to figure out what's askew or what's off, and we go from there.
So a lot of detective work involved in the therapy process.
Yeah, call us Sherlock Holmes, yeah. So we rely a lot on the subjective statement, so that just means the patient's history. When we meet with a patient, we rely heavily on what's going on. So we may ask questions like, has this happened before? When does this happen? Do you have certain symptoms like ringing in the ear, deafness? What are your triggers? Have you started any new medications? What's your blood pressure like? So we have to kind of go off of, start the detective work of what you're telling us, and then we're certain keywords and certain things that like, I associate that with inner ear issues, or I associate that with eye issues or ocular motor issues, we call it. Then we start testing in that direction, and if we start finding things that match up with your symptoms, then that gives us a plan to start treatment and helping you out.
And we'll be talking about what some of those exercises are, some of those strategies and techniques in just a second. We're talking with Craig Maden. He is a physical therapist assistant, specially trained in vestibular disorders with Steppin Up Physical Therapy. And the phones are open for you if you'd like to join with a question. 447-1190 is the number to call. The toll-free is 1-800-333-1190. Or you can always text us at, Heather, I've forgotten. What's the number?
46862.
46862. 46862. Just put whoa in the subject line, and that will come to us. And if you're shy and don't want to talk on the radio, that's one way you can get to us. Heck, I
won't bite. You can ask any questions you want. Happy to help.
You can also hit the HealthCall Facebook page and message us there if you like. Okay. So there is another condition that many people have heard about and kind of familiar with that differentiates and can be pretty readily resolved, and that is BPPV. Yeah. What does that stand for, and what's going on?
Yeah. BPPV, I'll break it down and I'll talk real slow because I talk fast sometimes. The B is called, it stands for benign, meaning it's not life-threatening, it doesn't spread, it's in the inner ear. P stands for proximal, meaning it's sudden onsetting. I get it all of a sudden. Positional, it happens with position change. I have to be moving to get it. If I'm sitting still in my chair and I'm feeling dizzy, you don't have BPPV, okay? And then the V is vertigo, and that's the sensation of spinning like we talked about.
Okay.
So benign, proximal, positional, vertigo. It's a mouthful. You don't need to know what that stands for. But that goes into the semicircular canals, or those moon-shaped canals in the ear on each side of the cranium. That is an issue with that. So inside, we can talk real in depth with this. So on each side of your head, you have those three canals. Inside those canals is something called the endolymph, or a fluid. And think of a level. When you move the level, the bead or the fluid, you know what I'm talking about, and the level, it moves. Same thing with your head. When I move my head, I tilt it, fluid gets moved in those canals, and they rub against sensory organelles or sensory systems in there, and that gives us position in space. Inside those sensory organs are these little hair cells, okay? And in those hair cells, with the fluid moves, it moves the hair cell, okay? Kind of like, I don't know, like a flag in the wind. All right, and it tells us where we are. On top of those hair cells are something called calcium carbonate, or crystals. If you had BPPV, you've been told that you have crystals in your inner ear, or rocks. Okay, there's no magical crystals in your inner ear. It's called calcium carbonate, and the reason we have those on those hair cells is to weigh down that flag or that hair. It makes it more sensitive, which is a good thing. We want to be working proficiently. I want to be able to judge sensitive movements. What happens though, and this can happen for a lot of different reasons. We can get that in a second. Remind me, Lee, to ask about why this happens. But what happens is the calcium carbonate can break off of those hair cells, and that can go outside the normal area and travel into the canal where we don't want it. And if you remember from health or science class, Newton's laws of physics, more mass equals more acceleration. So if I have more weight in that canal, because that calcium carbonate or that crystal, it's going to make small movements seem like fast movements. And we don't want that. So you can just do a subtle movement like getting on the chair, and you're spinning all of a sudden, and you feel nauseated, and you may feel like you want to vomit. That's the extreme. Some people just feel really uncoordinated and balanced. They have to sit down or have to shut their eyes to feel steady. So that's what BPPV is. You can have it in any canal. We used to think it was just in the posterior canal. It was the most common, and it still is the most common type. A lot of times if, I lay down at night on my pillow, my head's tilting back, it's moving that posterior canal, and then that's what brings on my dizziness. Or I'm looking at a tall building, I'm tilting my head up, I get dizzy. That could be BPPV. Yeah.
So the good news about BPPV is it can be pretty effectively treated.
Yes, it's honestly, if it's just BPPV, which it sometimes isn't always, there's other things going on with it too. If it is pure BPPV, we can sometimes treat it in 1 to 3 visits. And I always quote people on that, and it turns out that, it's 2 canals instead of 1, and that raises the severity and complexity, or there's ocular motor things going on, but it technically is a pretty quick fix. It's basically the position, how we test it. We do something called a Dix-Hallpike or a roll test, and I am putting your head in a certain position and looking very intently in your eyes. When I put you in a position of provocation or to elicit these symptoms, you'll get nystagmus if you have it. And nystagmus is called involuntary eye movement, and your eyes will start beating in a certain direction very fast. And then based off of the beating or the direction of the eye movement, I can tell what kind of BPPV you have, what ear it is, and how to what canal it is, and how to treat it. And then we go right into the repositioning fix, or the maneuver, if you want to call it that, and to get that calcium carbonate or that crystal back into where it should be. And sometimes that can happen in 1 treatment, sometimes it takes 3, 6, it just depends.
I think it is pretty clear that Craig Vandermaden from Steppin Up Physical Therapy understands vestibular disorders pretty well. And if you have a question, we hope that you'll give us a call. We're going to take a commercial break. When we come back, more with Craig, we're going to be talking more about what can you do if you're suffering this type of vertigo, dizziness, this entire mess of vestibular disturbance. And so that's on the table this half hour, and we want you to join us on the program at 447-1190. You are listening to HealthCall Live on WOWO. Good to have you on board this morning. HealthCall Live is the program. Craig Vandermaden from Steppin Up Physical Therapy is our guest. We are talking about dizziness, vertigo, and what you can do about it. It is a serious problem for a lot of people. And Craig, one of them is Kelly. She's on the line with us now. Kelly, you have a question about dizziness? Tell us more about that.
My mom is elderly. She's in her mid-80s, and she experiences occasional dizziness. She's in pretty good health, still lives in her own home, gets around okay, but she does talk about occasional dizziness, especially when she gets up after she's been sitting for probably far too long on the couch, watching TV, because she doesn't have a lot of other things that she's doing these days. I just have a concern that she could fall. I'm not sure what the cause is, if it's just because she is in her mid-80s. Is there anything that I could do or have her do, maybe through exercise or therapy, that would help avoid a fall?
Yeah, that's a great question, Kelly, and I think that's a common concern with our loved ones, and that especially if they're aging. Sometimes, like Lee talked about before, 75 and older, sometimes that can provoke more issues with the vestibular system balance. With your mom in mind, a couple of things come to mind. It said it happens when she's standing after long periods of time, or when she gets up from standing after long periods of time. Sometimes it could be something called orthostatic hypotension, which means you've been sitting for long periods of time, you get up and you have a quick drop in blood pressure. That could be something. I don't know if her blood pressure is regulated or not. It's something to talk talk about with her doctor or look at. We can also check that out at Stepping Up. And then also medication. Sometimes as we age, we have to take more medications. That can affect your balance and vertigo, dizziness as well. Or it could be maybe something like we talked about before, the BPPV, a positional change thing. Honestly, I wouldn't be able to put a finger on it without meeting your mother, but I'd be glad to have her come in and meet her and go over her history and see if we can help her out.
Are there some strategies, some tactics, something that Kelly's mom could do before she stands up? If it is that little blood pressure thing, is there anything you can offer in that vein? Yeah,
and I'm just talking aloud with you and brainstorming. I'm not saying this is for sure or not. I'm just kind of some of the things when you're talking about your mother as some of the things that the red flags or the things I was thinking about. But she could maybe before she gets out of the chair, she can kind of scoot forward in the chair and take her time getting out of the chair. So maybe instead of just getting up and popping up, sometimes when we're 80 years old, we have to use some momentum and get out of the chair to pop up, and we got to do that quickly. And that momentum can cause a quick rush or cause some dizziness in itself. So if she's been watching TV for 30 minutes or an hour or whatever it is, she can kind of scoot out of the chair and slowly get out. Get her bearings, get her feet underneath her before she gets up. Also, one thing too is if she is getting dizzy, this is for anybody that has dizziness, finding an anchor point or a waypoint, I call it. If you're in a grocery store or you're walking and you're feeling unsteady, try to look at something that's not moving. If you can visualize an anchor with your eyes, that's going to give you a steady point, and that can decrease your balance in itself. And that's a strategy I teach patients as well. If they're getting dizziness, I had somebody that was a truck driver that had dizziness, and we were able to help him out, but he was still has some dizziness along the way, so he had to stare at something that was not moving to gain that sense of equilibrium, and that helped him focus.
Kelly, I hope that helps.
Great. Thank you so much.
Yeah, hey, thank you for calling in. Yeah, you bet. So that strategy is kind of like what we use for seasickness, right? You always focus on something off in the distance, a steady state.
Exactly. If you talk about seasickness, that's you had those three systems of balance like we talked about. You're staying still, but the rest of you is moving, and that's causing confusion, and that's why you feel sick on a boat.
Let's keep on the phones here. Go right ahead with your question for us.
Yeah, I apologize for my voice. I'm going to give you a little history. I was in a motorcycle wreck, and I lost my right eye, the vision in it, and I got an iris. I lost my iris in my lens. Well, now I was a journeyman lineman. I climbed high pole stuff. It didn't bother me. Now I get real dizzy when I get around any high places, and I never was like that before.
We're getting a little tight on time, so I'm going to have to move you along here. Craig, what could you offer for this gentleman?
Did you ever have did you ever get told you had a concussion or anything like that?
Yeah, I did.
Okay.
It shattered my right side of my face.
Okay. Yeah, this is.
Go ahead.
Oh, sorry. Thank you for calling. Number one. Number two. This may be a more complicated. Scenario where I won't be able to necessarily help you over the phone, but I would love to meet with you and discuss this more in detail, because there may be a couple different things going on. I've dealt with patients with concussions before, and if I think I would stress that maybe taking care of this rather than putting off. But I would be more than happy to meet with you at Stepping Up. I'm sure you can find us on. Give us a phone number or website, and we can schedule maybe a consultation and go from there.
Sorry to hear about that. Sounds like a pretty devastating accident. Glad you made it through, and hope you can find some help and some relief. In a situation like that, so you're going to do the assessment, et cetera, but then what is the therapy going to look like going forward for a gentleman like that?
Are we talking specific concussion or?
Just anybody who's got that kind of balance challenge. You mentioned the laser So you're strapping a laser on my head and then teaching me to keep that balance.
Right.
But I know there's more that you do.
Right. So it goes down again to the individual. We need to figure out what the triggers are. Where is the hypo or the lack of function in? Is it the inner ear? Is it the sensory? Is it the eye function, the ocular motor function? And then basically, in a pure sense, we find out what's weak and we strengthen it.
So if it is that visual issue, what kind of exercises are you going to have me doing?
Right. And like I talked about before, I'm not trying to get you out your glasses and get you 20/20 vision. That's not what we can help you with. It's your eye's ability to track things smoothly. So there's something called smooth pursuit. That's your eye's ability to track something smoothly. People with ocular motor deficits, I have them follow maybe a dot, and they're following it. It's very shaky. It's choppy. It's ratchety. Also, there's something called saccades. It's your ability from transitioning from Lee's face over to the microphone. I can transition back and forth quickly. There's also something called your vestibular ocular reflex, and that's your body's ability to maintain gaze on something when your head's moving. I'm doing this to Lee right now. You can't see it at home, but I'm looking at his nose, and I'm moving my head back and forth. My eyes move in the opposite direction my head does. That reflex helps you keep a steady gaze on something with your heads moving. There's a lot of other issues too we can work on, but essentially if you can't follow something smoothly, or there's ratchety or choppy movement when you're following something, that's going to make you feel dizzy because your body, your inner ear is saying you're staying still, your feet are saying you're staying still, but your eyes are moving and you're moving at a faster rate. That's causing confusion between those three systems, and that's making you feel dizzy. So we need to kind of dial it in and work at your body's ability to more proficiently, I guess, if you want to call it that, track things and handle that input. It's all about input.
And it's all about the help that you're going to get at Steppin Up Physical Therapy. Craig Vander Maden is a physical therapy assistant specialist in vestibular disorders. Steppin Up Physical Therapy is online at steppinupt.com, steppinupt.com. They have 4 locations: Calhoun Street, Auburn Park Drive, West Jefferson Boulevard, and Coldwater Road. So there's a location that is near you and convenient to you if you have a problem with dizziness and balance. Craig, thanks so much for coming in.
Yeah, thanks for having me.
You bet.